Hong Kong health authorities have activated their most serious response level after an outbreak of a new type of viral pneumonia in China.
A man has died from a new pneumonia virus in the central Chinese city of Wuhan. 41 other people have been diagnosed with the virus that investigators say resembles SARS.
There is now a report from the Center for Disease Control that they have the first U.S. case of that coronavirus.
Centers for Disease Control and Prevention is confirming the first case of human-to-human transmission in the United States of the novel coronavirus. The World Health Organization has declared the coronavirus outbreak a public health emergency of international concern.
61 passengers have now tested positive for the coronavirus on the stranded Diamond Princess ship.
New York now confirming its first case.
New York is one of a handful of states that's now declared a state of emergency.
Coronavirus has taken over our everyday lives. We wear masks, social distance, and take extra precautions for the safety of others. Many lives have been affected by COVID. There are over 74.1 million cases and 1.6 million deaths. COVID-19 is caused by a coronavirus called SARS-CoV-2. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. Some symptoms of COVID-19 are fever or chills, cough, shortness of breath, fatigue, muscle or body aches, new loss of taste or smell, sore throat. In the United States alone, there are 17 million total cases and 307,000 deaths. The total cases in Kansas are 198,000. Many of our health workers are being able to see this threat close up. The pandemic has affected many lives more than we can count. Here's Jessica Humphrey, the school nurse at Holcomb High School. Okay, I am here with Jessica Humphrey, and today we are going to ask questions about COVID. So, Jessica, in your opinion, what do you think is one of the biggest changes that happened in your life since COVID?
Well, for here at school, a lot of things changed, like the masks, having to distance, but then for me as the school nurse, I have to do a lot more follow-up on illnesses and just monitoring the school health as a whole to be able to keep us in the building as long as possible. COVID affects all of us right now in different ways, even just having to wear a mask and having to distance, but I think, probably all of us at some level have been affected personally by COVID in just someone we know or some people, that we are in contact with, and so it does affect all of us in some way.
What do you think the future will look like?
Right now, we don't know. We don't know even what tomorrow will bring. I feel like things change pretty quick in the world of COVID, and so because of that, we just don't know. I wish that we could say, hey, this is the end, or this day will be mask-free, but we don't have any answers right now, unfortunately. But I think as a whole, we're doing really well, and we're still at school, and we have a lot that we can be grateful for.
Thank you for your time.
You're welcome.
Coronavirus is spreaded easily through crowds and crowded areas. One area in particular that is extremely crowded is the Tyson plant here in Holcomb, Kansas. Here's Nicole Magana talking about the Tyson plant where she is currently employed. I'm here with Nicole Magana, and I will be asking her a few questions about COVID. Are you ready? Okay, so I know that you work at Tyson. How has it affected your work area?
Not mine so much, because I do have a personal office, but we are required to do temp checks every morning. Masks are mandatory, and we do have sanitizing stations.
Okay, thank you. How do you think Tyson is dealing with the spread of COVID?
They have brought in cleaning crews to come in periodically and clean, wipe down hallways, desks. In the cafeteria, they've also inserted plexiglass in the cafeteria so nobody's face-to-face with anybody. They also have sanitizing stations throughout the whole plant, and they're constantly taking breaks to clean and wash up.
And how has your schedule been like since you have 2 kids and you are working full-time back at Tyson.
I was able to work at home for a little while when schools resumed back in person. I went back to working at the plant.
All right, thank you for your time.
Thanks.
Students are also extremely affected by this pandemic. School is going remote and work is online. Students wear masks throughout the school day if they are still in school, and school activities are being canceled. Schools are meeting online through Zoom. Teachers are also having to learn how to use online classes in Zooms to keep students engaged in their education and keep learning. Here's Macias, a Holcomb High School student. I am here with Macias, and today I am going to be asking her a few questions about COVID. Is that okay with you? How do you think that the future is going to be now that COVID is a thing?
I feel like it might go back to normal, but not for like a really, really long time, just because I feel like we need to start like being more strict on like all the rules, and we're not really doing that. So I feel like once we do that, then we're gonna start like seeing like changes, like to go back to normal.
And how has school been for you with COVID?
It's been a lot harder just because it's all online, and I feel like I haven't really learned anything. It's a little bit harder to keep on track because Edgenuity gives us a lot of assignments.
As a student in high school and a part-time employee, in your work, how has it affected you?
It's affected me a little bit just because I feel unsafe whenever I'm at work because no one ever really wears a mask. And at school, it's just mostly just like Edgenuity because that's kind of like hard. That's basically it.
All right, thank you for your time.
Thank you.
Everyone has been affected one way or another with this pandemic. These have been very difficult times, but it has brought us together as a community and made us stronger.